And well, at EHA, it was a privilege to present on behalf of Dr. Peter Voorhees and my Alliance colleagues. Dr. Saad Usmani and I both presented our poster together of our results of our phase 2 randomized trial, where we looked at the combination of pomalidomide and dexamethasone compared to pomalidomide, Ixazomib and dexamethasone in relapsed refractory patients. Now, they'd have received one prior line of therapy, but they had to be lenalidomide refractory. And so entering the study, it was a well-balanced population in that regard. We had good African-American representation, about 12 to 15% African-American participation in the study overall, which we were very pleased to see. And we also were enriched for high risk. We had about 40% high-risk cytogenetics as defined in the protocol in the study. And what we were able to show is that the response rate for pomalidomide and dexamethasone was somewhat as expected. It was around 46%, significantly higher for the Ixazomib pomalidomide dexamethasone combination at between 65 and 70%. And what was really interesting was the progression-free survival advantage. The progression-free survival advantage for POM-DEX was actually only around 7.5 months, when in fact for Ixazomib POM-DEX it was striking at 20.53 months. So this was a highly significant difference. The hazard ratio was around 0.35 in favor of the triplet. So for an all-oral combination that was well tolerated, we were excited by this result, recognizing the limitations of a randomized phase 2, but nonetheless a well-sized one. And what was particularly important, Tom, I think, was the following. This was an all-oral combination used during the COVID-19 pandemic. We had no COVID-19 mortality on study, and we were able to offer patients an oral approach, all-oral approach, so minimizing clinic visits and minimizing potential exposures. So a real-world study providing real-world information.